Hello everyone, welcome to The Key Opinion, a Docplexus series featuring eminent physicians in the medical field. Today we have with us Dr. P.K. Grant, one of the most experienced specialists in the field of cardiology. He is the Chief Cardiologist, Chairman of Cardiovascular Services and Managing Trustee at the Ruby Hall Clinic in Pune. Dr. Grant has been practicing for almost 30 years now and has conducted more than 8,000 free clinics across far areas of Maharashtra. In recognition of his services to the medical field, he has been conferred a number of honors, including 3 national awards. Thank you so much, Dr. Grant, for the interview.
Thank you.
So let's begin with the first question. What has been your experience as you're the chairman of the cardiovascular services at Ruby Hall Clinic?
We started doing cardiology at Ruby Hall nearly 32 years ago. We started in a small way, and today I can tell you that we have achieved a great deal. We are within the top 3 cardiac centers in the country, and on an average we do about 35 angiographies a day, something in the range of 11 to 12 angioplasties and 3 open hearts every day. The excellence that we have developed over a period of time is simply fantastic. The types of angioplasty that we do are mostly complex angioplasties, which very few hospitals in India do today. As far as cardiac surgery is concerned, we are operating on 1-day-old children till 90 years old elderly patients. So it's quite a spectrum that Ruby Hall has. We have around 25 to 30 cardiologists and cardiac surgeons attached to our hospital, and we run 4 cath labs non-stop from 8 o'clock in the morning till 8 p.m. in the evening.
Okay. So doctor, my next question to you is, several studies have reported that cardiovascular disease is leading cause of mortality. What preventive measures can be taken to reduce this risk?
Cardiovascular mortality is definitely going up, especially in India, and I'm seeing more and more young people in the age group of 25, 30, 35, 40 coming with severe coronary artery problems. One of the main reasons for this problem is that, number one, it is factors like poor diet. We are finding that we don't eat the proper diet. We are having too much red meat, too much fat in our diet. We also don't have too many things like samosas, etc., which are saturated fats. And I think this needs to be looked at very, very seriously. So one is the diet. Second is lack of exercise. We are finding that most of our people don't take exercise enough. Lack of exercise is definitely a risk factor of coronary artery disease. I myself finish work at about 7:30. I go straight to the gym for 45 minutes. After going to the gym, I go home and then relax and do what I want to do. The other thing is obesity. More and more people are getting obese, and that is another risk factor of coronary artery disease. The other 2 risk factors we need to talk about, one is diabetes. If you have diabetes, you must control your blood sugar properly and keep it under control, because diabetes leads to coronary artery disease. The other factor is hypertension. You must check that your BP is very well controlled, and that if you have hypertension, this should be looked into. The one more risk factor which I think we should also look at is cholesterol and triglycerides. Some LDL, what we call. Some people say it's not important, cholesterol is not important. Some recent studies have said that, but I think if you have a high cholesterol, you definitely are at a higher risk for coronary artery disease. Similarly, if you've got a high LDL level, you're definitely at a high risk for coronary artery disease. One more and last factor is genetics, because genetic plays a very important part. If you've got bad genes, it's bad luck. If you've got good genes, it's good luck. Those who have got good genes normally have less incidence of coronary artery disease, and those who have bad genes, that is their parents have coronary artery disease, definitely have a much higher incidence of coronary artery disease.
Right. So doctor, can you please elaborate on your recent study on percutaneous balloon mitral valvuloplasty and suggest preventive measures for pulmonary artery hypertension?
See, mitral stenosis was a big problem when we were all in medical college because there was a lot of rheumatic fever, so we used to see a lot of mitral stenosis. Nowadays, what has happened, slightest person gets a cold, he goes to the general practitioner, he gives them antibiotics. So the infection doesn't go into the heart valve. So new cases of rheumatic heart disease, new cases of mitral stenosis are not as common as we used to see 30 years ago. In fact, when I came back from England 30 years ago, we used to do at least 2 to 3 mitral BMVs every day. Now we do about 2 or 3 in a week. So you can see that mitral stenosis is slowly a dying disease in our population. Of course, mitral stenosis does lead to pulmonary hypertension, but if you open the valve, you will find that the pulmonary hypertension will definitely start coming down and come under control.
Right. So doctor, my last question is, what factors do you consider to ensure a successful cardiac surgery and improve patient care?
Successful cardiac surgery means that the person goes home practically cured, and it starts from the day the surgery is done till the time I would take at least 1 month, because that's the time they take to fully recover. Success cardiac surgery is always a team effort, and it's not only the cardiac surgeon, the anesthetist, the perfusionist, post-operative management, and finally physiotherapy and rehabilitation. These guys have to be rehabilitated and put back to their routine life. It's a very traumatizing experience for the patient, especially if the patient has to be operated on a heart-lung machine. Because, I mean, it's a big operation, it's a 3-hour operation, and luckily now I think the success rate is more than 99% in most good centers.
Yeah, and also patient care, like probably post-surgery, if you would like to elaborate.
Post-surgery is mostly done by the physiotherapist and the physician treating the patient. But physiotherapy is very important, especially chest physiotherapy and rehabilitation back to normal lifestyle.
Okay.
Thank you.
All right. Thank you so much, doctor.
Thank you. It's my pleasure.
Having you here.
Thank you very much.
Thank you so much.
Thank you.